they must know something we don't. They just, it sounded reasonable. We're living in a false reality that sounds reasonable, like the Truman Show. It's just not. Well, once you start looking at the world that way and you say, okay, so there's not all these viruses. This is a lie. So what is there? Well, then you find out, then you start thinking about it, and there are not that many things. They would tell you that there are 70,000 diagnostic groups, this new ICD-10, which is a book of disease codes. We used to have 7,000, then we went up a little bit. Now we're at 70,000 disease codes. Do you really think there's 70,000 causes of disease? No. There's a few causes. And the question is, what really are they? Well, electromagnetic frequency is one, whether it's artificial or the sunspots. The sunspots traditionally cause outbreaks of influenza, so we know that happens. They can artificially give it to us when they had us walk around with cell phones. That's when we got H1N1. There's so much evidence for electromagnetic frequency causing disease, so we know that happens. Well, what else is there? Well, we know there are parasites, but, we were always taught in medical school that parasites were a third world country. We'll teach you about this stuff. This is the 1970s when I was in medical school. We'll teach you about this stuff, but don't worry about it. This is third world country stuff. Well, no, it's not. And the CDC, if you go on their website, the CDC, it turns out, is talking about how a huge percentage, I think it's something like over 30% of Americans have toxoplasmosis and in the brain. So what else didn't they tell us? Well, it turns out a lot. And I was a spine surgeon for most of my career, and one of the things I did was a lot of neurologic consultations. People would be sent over to me with weakness and neurologic symptoms that they couldn't sort out, and the question is, do they have a cervical or lumbar lesion, something going on? And sometimes I would see people and think, oh, maybe you've got multiple sclerosis. That's something we need to rule out. So how do we do that? Well, we get MRIs, and we get an MRI of the brain and the spinal cord. And if it shows these characteristic plaques, that's what they call them, and they're just colored spots on the MRI, then we say, yep, you got MS, multiple sclerosis. Now, we don't know what causes it, but there's some interesting things about it. So, for example, in medical school, I was taught that if you had a lap dog, meaning a small dog that jumped up on your lap, before the age of 5, it increased your risk of MS. Why in the world would that be true if it's an autoimmune disease, something that's just strikes you out of the blue, like they told us? Well, that they didn't really know what it was. Well, it turns out that now that they've done careful pathology, there was Dr. McDonald was a pathologist, and he looked at a bunch of patients, a series of 10 unselected patients dead of MS, and 100% of them had parasites in the brain and spinal cord corresponding to these lesions. In fact, in some cases, he would actually see the little wormholes in the brain. Most of the time, this is microscopic, but occasionally you'd see overt nematode wormholes. So we never asked what those plaques were. We're not looking at root causes of disease. Now, there are German scientists and physicians in the 60s, for 20 years, from the 1960s to the 80s, these guys had been screaming that in every case of cancer, they saw parasites in the bloodstream and in the interstitial tissue, and nobody was paying attention. Well, they may have been paying attention, but they couldn't say anything because cancer is such a cash cow for the pharmaceutical companies that if you go against it and survive, and by the way, I'm not suicidal, if you say, oh, that's just, it's actually parasites causing cancer, that would drop a multi-billion dollar industry. So they don't really want that. So that information, if you're a scientist or a research doctor or whatever, if you try and publish a paper saying that, you won't get published. And that's the other thing I found out, is that all of medical and scientific publishing is essentially owned by the intelligence services. That's a shocker. In World War II, Charles Darwin's grandson and Alexander Fleming, who discovered penicillin, they went to the British government and they were complaining about scientific publishing, that they kind of got snookered about not knowing what the Germans and Japanese and the Americans were doing, and that we needed better scientific publishing. And at the time, the British government said, no problem, we can do that. And they could say that because MI6, the British spy agency, owned Butterworth's, which was the largest publishing house in the world at that time. So they joined with Springer out of Germany, and they made even a bigger publishing house. Now, this was probably still is, the world's largest publishing house for medical and scientific papers. This is if you're a doctor or a scientist and you want to publish your paper, you have to go through these guys. And it turns out that the first editor that they assigned to this new publishing house, which they called Pergamon Press. Now, I don't know. I mean, I'm not a biblical scholar. I learned this from somebody that is. And they said, wait a minute, Pergamon. Oh, I know what that was. That was an ancient altar in Anatolia, which is now Turkey. It was called the seat of Satan in Revelation. Why would you name your publishing house Pergamon? Anyway, it turns out that the first editor-in-chief was Robert Maxwell. Robert Maxwell was not a scientist. He was a spy for the British in World War II. He was presumably a Mossad agent because he's buried on the Mount of Olives. He's rumored to have been a KGB agent. And I mean, he's intelligence royalty, in other words. We know he's involved in the CIA because his daughter is Ghislaine Maxwell, the pedophile consort of pedophile Jeffrey Epstein, and they were big involved with the CIA. You can't make it
Mossad, too. I think Epstein and also Harvey Weinstein are both Mossad. I mean, how do you hire ex-Mossad guys as your security detail? Well, I've said this 100 times probably. Well, you go to the LA Times and look at the one ad, say, I'm a Mossad officer with like 20 years of experience. I'm looking for a gig. Call me at this number. I don't think that happens. You don't get Mossad agents unless you're Mossad yourself. That's just what I'm thinking here. Okay,
yeah, I'm thinking right.
And so, Do you know, we've got about half a minute here, but I want to toss this out and just toss this out to you. I have seen repeatedly that a virus, just like with this COVID-19 thing, is like we isolated the virus. Well, we haven't been able to isolate the virus. No, we definitely isolated the virus. I understand it's impossible to isolate. Nobody has ever isolated a... Oh, there you go, right there, folks. Do you see, ladies and gentlemen, why we are here? People cannot take this kind of stuff, boom, all at once. They just can't. So we just go through it step by step. And eventually, I said, can I ask you a question here that only someone in your profession might be able to answer? They said, he kind of looked at me like, uh-oh. So I said, it seems to me that there must be a virus or parasitic component to cancer. Does either of those two things feature in your work at all? And kind of went into a trance for a minute. He really did. And he said, well, there are people looking into the virus component. And that's all he said. He just walked off. He didn't want to talk about it at all. So are we thinking that, I mean, I've even heard recently that they're beginning to treat cancer with, or at least entertain ideas of treating cancer with stuff like ivermectin. Is that possible? I'm pretty sure if that's out there, you've heard it.
Okay, well, now have I heard it? I've seen the papers. They're doing all these research. You can go to the PubMed site and you can see, or the NIH site, and you can see all these research programs ongoing using anti-parasitic drugs from now even fenbendazole that's for dogs and animals, horses and things. And there's a fenbendazole. Fenbendazole.org has been around for quite a while now. It's a guy who treated himself, got over his cancer using this medicine. It's an anti-parasite medicine that he learned about from his veterinarian. Veterinarians know something about this, and so do parasitologists. I talked to a 30-plus-year Egyptian parasitologist, and he made the comment that when you look at cancer slides of solid tumors, and you look at slides of parasite egg sacs, they look almost identical. They look identical. And he said, but no oncologist he's known ever made that association. He said in parasitic circles, parasitology circles, we talk about it all the time. Well, they talk about it privately, but they don't come out and say it publicly because then they would get defunded. Right? I think that's what's going on. And they're looking at ivermectin, not just ivermectin, they're looking at ivermectin, albendazole, fenbendazole, what's the other one? Nitazoxanide. They're looking at a bunch of different things. And the funny thing is when you listen to what they're saying, they say, yeah, we think it might stop the cancer by these microtubules not being, they're just going out of their way to talk around the fact that the reason all these drugs work is because we're dealing with cancerous parasites. They just can't bring themselves to say that. And it's really kind of funny. It's like counting your beef herd by counting the legs and dividing by 4. They come up with all this cockamamie logic when the simplest answer here that fits everything we see. It fits why the young men in the military, young soldiers in the military are showing up with multiple metastases. They're calling them metastases because after they took the vaccine. Well, why does that make sense? I asked a friend of mine in the military, I said, do you believe that cancer changed its stripes in 2021? No, the answer is that we knock down the part of the immune system that keeps parasites in check. And whom were we dealing with in the military? These guys are out in the boonies, and they're eating bad, contaminated food out of necessity sometimes, and water may not be pure, and they're snooping and pooping and crawling through the brush. They're probably riddled with parasites, but they're young, healthy people. Their immune system keeps those parasites in check. Every day you swallow numerous parasites, and most of them just pass through you, but a few of them linger around, start being mother worms, mother parasites, and they have babies, and those babies pass through you, but some get encysted into your muscle, your brain, your liver, then their body walls them off into these little tiny microscopic cysts. But if I knock down your immune system, it's kind of like getting, in the days of the Roman Empire, not having enough border guards to guard this expanding empire. So if I knock down your immune system, then these sentinel soldiers that are taking care of these parasite cysts go away, and the cysts are allowed to grow, and the parasites get out. Literally everything we think about cancer, when you really start taking it apart, and I don't have time to do that right now, but if you go down the list of all the things we see, like, for example, why does cancer sometimes show up in areas of trauma? Well, this can be explained by the parasite theorem. Okay, why you get cancer when you're older, not when you're younger, even though they want to blame it on genetics. We have the same genetics when we're born that we do when we're 60. Why does cancer wait till we're 60 in general? So it really explains the whole thing. And it explains why people get MS when they have a little lapdog, okay, before the age of 5. Why is that? Well, because before the age of 5, your blood-brain barrier is not solid like it is when you get older. And so if a dog licks you on the face and gives you a little parasite, it's more likely to end up in the spinal axis inside your CSF in the brain or spinal cord than it is if you're older and you've got a barrier there that it can't get through. So that, again, makes sense. Everything here starts making sense when you really start looking at the idea. And I'll tell you John, this is my own personal experience. One of the things we're taught in medical school is that when somebody has night sweats, that's a bad sign. Persistent, soaking night sweats is usually a sign of cancer, right? They don't have it. They're going to show up with it later. You may not be able to find it right away, but they show up with it eventually. Well, I had that for like 5 years. I had progressive night sweats before COVID and during COVID. I mean, it was nothing new. And I would soak the sheets at night. But I looked around. I thought I was doing everything I could in an anti-cancer way, and I didn't have any. I had colonoscopies. I checked myself out. I had normal blood. I mean, I was picture perfect, but I had these night sweats. Well, then when I learned about all this controversy about parasites and that we should be treating ourselves for parasites, I decided, okay, I'm going to start myself on a parasite protocol. And the first treatment cycle, so you could choose different medicines to do this, like fenbendazole. My favorite is fenbendazole, nitazoxanide, and ivermectin. But, other people may have their favorites. That's just my three. And I started myself on nitazoxanide, which is not one most people had heard of. I had not heard about it before, but it has something, it treats Hydra. And I thought, if that's around with all this artificial stuff, I'll try that one. I took 3 doses of that, and I never have had a night sweat since. I'm not kidding you. It was parasites. And the only time I've ever had a night sweat, I shouldn't say I never had a night sweat. They completely went away. But and then as I went through my parasite protocol, and this is all listed on my website, people can find what I believe about it. It's not official medical advice, but if you want to know what I've learned and what I think, you can go to themedicalrebel.com. That's where I put it out there. And I've got a video and a protocol you can print out that I use. Anyway, I was doing that, and after about 6 months, I started lengthening out the time between treatments, and I started noticing I started getting night sweats before the next treatment, so I had to shorten up the treatment cycles again. So everything makes sense, and it's treatable.
And one more time, you treated this with what?
Well, I treated it with, like I say, ivermectin would work. Ivermectin is easy to get. You can get it from overseas. Fenbendazole is easy to get. You can get that off Amazon, or you can go down your horse store, and get it. And nitazoxanide is more expensive. It's theory. I did it for theory. Again, I was thinking theoretically when I started on that one. It's not one that I usually tell people to start with, but it is another anti-parasitic drug, and I just get it from overseas pharmacies.
What it might have been? Case, I thought you said nitrous oxide for a minute. I know she didn't say that.
No, it's nitazoxanide. It's a drug that, remember when Carrie Maude showed that little thing under the slide from one of the Pfizer vials or Moderna vials? I can't remember which one it was, but it looked like, and she and I talked about it, and it looks kind of like a Hydra, and
oh yeah,
there's a lot. Remember that? Okay, well, there's a lot of speculation, and based on some real thinking about, is Hydra involved in some of this? In other words, when I was a spine fellow, they were using Hydra with the idea that they could bridge spinal cord gaps using this. It's not really a parasite. It's a it dwells in aquariums. It's a contaminant of aquariums, but it's a free-living microorganism in nature. And it has the properties of being immortal, being able to be cut into a million pieces and every piece will regrow. And it can intercalate into animals' nervous system and not be rejected. So that was why the people were looking at it potentially, at least that's what the excuse was, for nerve cell regrowth. Well, then when all this started coming out, we're seeing these weird clots and a lot of things. I thought, maybe this is really what it's all about. So I looked at the aquarium. I didn't know how to deal with Hydra, but I looked up what the aquarium guys. I found out it was a contaminant of aquariums. I said, wonder what those guys treat their aquariums with, and it turned out to be nitazoxanide. And then I discovered, you'll love this, the remdesivir studies that they were doing, because they wanted to make remdesivir look better. One of the studies they mixed with ivermectin, and another one they mixed with nitazoxanide, because they know those drugs work. So, again, we haven't talked about viruses in any way, shape, or form here, and my point here is viruses are a very convenient mythologic being that if you believe in them, then I can convince you that everything that happens to you is created by one of these new viruses you should be afraid of, like bird flu or Marburg or monkeypox or you name it. You're going to play disease whack-a-mole forever. That's why we have to realize it's a scam. It's really a great anti-human agenda. It just doesn't turn out to be true. There is no proof. In fact, they actually tried. This is a story I tell people to convince them. Influenza just means influence. It's never been proven to be a virus. They want to tell you it has, but in 1918, the great pandemic that wasn't, when they really tried to determine what was causing it, they had volunteers these are people, 108 volunteers in a hospital in Boston. They put their face over the face of dying influenza victims. These people, they were told, don't touch the patient, but when the patient breathes out, we want you to breathe in. So these 108 volunteers were breathing in the exhalations of dying people from the pandemic. That's what was told.
That's terrible.
And not one of them got sick. Not one of them got sick. And then they actually took their nasal secretions, their oral secretions, and they swabbed the sick and dying. They stuck it in the well. Not one of them got sick. Then they injected them with fluids of the sick. Not one of them got sick. Horses in those days were getting, quote, influenza. They were getting sick, and they would put a feed bag on a horse that was dying. They would then transfer it to the well horse, and it didn't get sick. But that's not just then. We've tried this multiple times. It turns out the thing about poliovirus, they could never show that poliovirus could be transmitted through the nose or respiratory tract. In order to transfer, the only way, in this guy's study, with John Anders' study years ago, the only way that they could transfer poliomyelitis from, quote, one animal to another was by injecting it into the animal's brain. That's not transmission of a virus. That's poisoning people with toxic whatever from another animal.
Right?
And it goes on to COVID. In COVID, they couldn't prove it. There was just a study that came out, and the researcher from England said, we bumped up the dose 10,000 times, and we still couldn't get anybody to get sick with what they thought was COVID, right? So I don't know what they were using, but in any case, it was not. They haven't proven airborne transmission of any viral disease. I will, if anybody can show me differently, I'm happy to see it, but I have not been able to find it. It's all been a scam. And so once you believe that, you say, well, then how do I not get sick? And the answer is we are being or how do we get sick? We're being poisoned electromagnetically. We've got all these weird cellular wavelengths. And actually, they knew this way back in the 1800s. When they first laid down the telegram lines, people started getting sick underneath them. They called it telegrapher's disease. I have a paper on front of my website that tells everybody about this. But they found out if they did a long twist in the copper wire, it would pretty much go away. So it tells you it had to do with the electromagnetic field effect. So we know that's happening. And that's why I'm bringing up, I don't think this is natural solar flares that are happening now. And people are getting sick. I'm one of them. I had a little issue with arrhythmia of my heart. And it's correlated not necessarily the solar flares, to turning on these NextRad radar around the country that have been coming on in these weird patterns since all this is happening. So we're being bombarded with this stuff. So that's one way. Another way is parasites. And the big way is poisons. We're being poisoned. And what really disease is too many toxins and not being able to detoxify.
How do you do that? How do you detox from electromagnetic frequencies, for example?
Right. Well, here's how you do it. And again, this is why you get sick with electromagnetic frequencies. There's really a couple mechanisms that we know of, and probably more. But your body actually gets rid of toxins. Let's say you get on a plane and they just sprayed it down with all that hateful, Lysol type stuff to disinfect the plane. You have to breathe that stuff for 4 hours while you're trying to get to some other place. Right. Well, the body sent those are toxins. If you had a buildup of that, it would kill you. But your body always is self-regulating. It's getting rid of toxins. So the way it does it, it puts electromagnetic charge around the toxin and pushes it out of the cell. And then it gets into the lymph, into the blood, into the liver, and gets excreted in your stool. Well, for that system to work, it turns out you have to have the ability to put the charge around the toxin. And that involves the fact that every cell in your body is a battery. It has a negative and a positive pole. It's a dipole. And to keep those batteries charged, you need a couple things. You need to have a charge differential across your cells, and you need to be able to get out in the sun and get infrared and near-infrared light. That's what charges your batteries. What did they tell us to do in COVID? Oh, stay inside. Don't get that nasty sunlight. Put on that sunscreen. It's all nonsense.
I didn't do anything.
No,
I didn't do nothing.
Right.
And guess how sick I got? Not at all.
Yeah, zero. Right. And they showed that when people in the old sanitariums for tuberculosis, and the Spanish did this with COVID, they put people outside in the sunlight and they got better. So your body knows how to get well if you just let it. And if you think about what your body knows, just reproduce it. So your body knows not to overeat when you're sick. You lose your appetite. Why? Because that adds more toxins to the body. When you start thinking toxicity, you know exactly what to do. Second thing your body does is run a fever. Why does it do that? Because when you run a fever, it softens the gel water in your cells and makes it easier to push these charged particles out to get rid of them. So what does the doctor in every ER, everywhere you go, people say, oh, we got a fever here, take the Motrin, take the Tylenol, get your temperature down. No. Your body knows what to do. No, if you're really got a high fever, get in a tepid bathtub like Grandma used to do and Mom used to do, and just sponge yourself down with a little tepid water and get it down a little bit so you're comfortable. But you don't want to get rid of your fever because your fever is adaptive. It helps you get rid of the toxins. Okay? So those are two things to do. Another third thing, do not take anti-diarrheal stuff like Imodium. Don't take that stuff because what it's doing is stopping up the bowel, but your bowel is pushing out. Diarrhea is your body's way. One of the